what's happening, guys and gals? Welcome back to my channel, and obviously to Dr. Downey's channel if he uploads that recording to his YouTube channel too. And today we have him again as a guest, and also we have another guest, which is his parrot, Eyebrow. Well, welcome, Eyebrow. So in today's video, we're gonna discuss and talk about the TRT, testosterone replacement therapy, and thyroid health, and last but not least, injuries and treatment protocols regarding that. So, could you explain the difference between the TRT and HRT, Dr. Dick Downey? I would be really pleased to hear the difference between the two.
I mean, most people would say that TRT and HRT are the same, which is not really true because HRT encompasses actual hormone replacement, and it can be used in women, especially post-menopausal women. So HRT is a bit of a broader term that encompasses more hormones than just testosterone, and then testosterone or TRT is literally just replacing your testosterone levels. HRT could range from replacement of estrogen to literal thyroid replacement or growth hormone replacement. So it's, yeah.
Even melatonin, it can count that, right? We can count that, right?
Exactly.
That's a hormone too.
Yeah, I mean, most grannies are on HRT too. They're taking melatonin to fall asleep or to help them sleep.
So what's the common TRT protocols and the dosage used in South Africa for males? I don't necessarily mean that female to male transitioning transsexuals, just males who got TRT.
In terms of TRT for males, it kind of varies because we have like different experts here and we have clinics here, and I haven't had much experience with the clinics. However, I do, so I have worked through one of the professors of clinical pharmacology, and we always seem to start off with 100 milligrams of testosterone enanthate weekly. We do have Sustanon here, but I don't think that's used as often. I haven't seen it being used. Yeah, we tend to use Pfizer depot testosterone, which actually is testosterone cypionate, sorry, or Nebido test, which is testosterone.
You mentioned that 100 milligram was generally is it the starting point or the goal, the 100 milligrams in treatment?
There's like no gold standard, but we seem to have just taken 100 as go-to starting with, and then in about 4 to 6 weeks we see where your levels are, and if it's higher then higher than what we want it to be, we'll lower it. If it's not there, we'll up it, typically in 25 milligram increments. But yeah, it's not really based on much science. There isn't too much science behind it. It's just what this clinical pharmacologist that I've worked through, it's what he suggests, and he says it works quite well. We do have the testosterone undecanoate, which tends to be used in like a lot older males who also do not want to inject themselves, so they just go every month for an injection of, I think, like 4 mils of this stuff, which is about like, I can't remember.
Is Nebido in vial or ampoules in South Africa? And I know that like a couple years ago it was in just ampoules. So someone who wanted to microdose it couldn't do.
Yeah, it's I haven't actually seen Nebido being used. I just know it is used for older men. But yeah, I think you would find it. I think it's in a vial, which is why they go all at once. I mean, like a ampule, sorry. I think it's just 4 mils, if I'm not mistaken.
It's 4 mils. But that's gonna be a first thing. Yeah, it's gonna be my first, like, literally admitting that I'm on steroids, TRT, now that I just started my TRT protocol. But
This guy's not natty.
yeah, obviously, I cannot. From now on, I cannot represent my country in Olympics or on weightlifting in weightlifting. So I'm sorry, guys.
Damn it.
So my TRT protocols, on the contrary to common protocol on South Africa, like 100 milligrams a week, I use like Nebido 50 milligrams a week. I literally inject 100 milligrams every 2 weeks, and
Oh, nice.
I, on top of that, I use just a very low dose of HCG, like on average 700 I use a week. At least my point was to uh, what at least my point was to maintain my like allopregnanolone and other neurosteroids while increasing my testosterone concentrations. That was my point of doing that.
Yeah,
It
I
might
really like your protocols.
it might sound a bit complicated, as if I'm changing couple factors instead of one, but actually, in a sense, I'm just changing less variables. If you take a look
Yeah,
at if you take a look at from the point of uh, maintaining your neurosteroids and maintaining the gonadal steroidogenesis. Obviously, there are cosmetic reasons too. Not
yeah, yeah, obviously. Yeah. But yeah, I really like your protocol. I think that would be the best protocol. I mean, I think testosterone undecanoate is probably one of the better steroids, especially if you don't want those side effects. So, those estrogen, it becomes a massive issue. And I think in urology, they tend to prefer undecanoate, although it was never proven clinically. They noted that there was less prostate hypertrophy with undecanoate due to, I'm guessing, not as much DHT conversion. I may be wrong,
yeah.
but yeah, they noticed it was more prostate favorable for undecanoate in particular. And the 2 week, doing it every 2 weeks is a lot better than the monthly one. But
If
yeah,
you take a look at
that's a
the
great
research
protocol.
from the Pfizer's uh, research of the Pfizer, you can see that after like the serum concentration of testosterone slowly increases towards the
Yes.
7 day 7 day, and after that it somewhat plateaus and uh, starts to uh, like plummet
Yeah.
slowly. Not technically,
Yeah.
it's not technically plummeting, but your serum levels
But
decrease. So
yeah, yeah,
every two
I
weeks,
get it.
I kind of maintain the steady state testosterone levels.
Yeah. Yeah, I mean, if you go online, there's just a good paper if you want to see why enanthate incipionate should not be your drug of choice. It's because, well, I mean, especially if you want just stable levels, if you look at those graphs on testosterone preparations, they literally go like that. Within a day, they peak.
At the same
So
time, it's
that's
a
why,
bit tricky to understand it for a guy who's outside of the PED world, like fitness industry. But
yeah,
in your also your natural testosterone value also fluctuates daily,
daily,
or
yeah.
actually hourly. So
Yeah,
literally during your evening, your testosterone value becomes the one third or maybe one fourth of your morning concentration. So it's a bit tricky for a guy to understand
yeah,
if he never researched it deeply enough.
yeah, yeah. But yeah. I think why did you choose 2 weeks as opposed to 11 days? I think it starts dropping at 11 days. Or perhaps I'm
Uh,
wrong.
I just didn't want to
It's
jab
out of
myself every week.
convenience.
That's the primary
Yeah.
reason. And secondary reason is it just I felt that after front loading with 2 cc's in my first injection, which is like instead of having like 50 milligrams every week, I just injected
Yeah.
500 milligrams at once to get a steady state testosterone value quickly.
Yeah.
And I
Yeah.
felt
Yeah.
that that
That's
depot
smart.
stayed there almost like for a 10 days. I could felt the lump in my ventral
Yeah.
area. It just stays there rock hard, literally, even though
Yeah.
it didn't cause pain at all. It was just a bit painful.
Yeah. Yeah. But I mean, for viewers watching, I mean, that's proper HR or TRT, not the other stuff that, is
Not adding
popularized
like
these
200
days.
primobolan on top of testosterone.
Yeah, I mean, there's a skewed perception of what TRT is, and what you've described as actual TRT.
Yeah, why? I wonder why pharmaceutical companies do not develop a birth control oral contraceptive pill, obviously for females, that contain lower amount of testosterone, since oral contraceptive medications tend to lower testosterone values by
Yeah,
half. So why don't
yeah.
they microdose like testosterone, like 1 milligram or 2 milligram per week for
Yeah,
females?
I was discussing this the other day, like because it's like a known thing that if you're just, or when you're on the pill, it's a common complaint that your libido just drops, and that's probably because you drop your testosterone also.
Yeah, in a
So it
sense,
would
that's
make
that's a
sense to,
that's a method of birth control in a sense. Having low libido, so you'll sleep less with your partner. So
yeah.
chances are your chances of
If you
getting
have no
pregnant
desire,
drastically low.
yeah, abstinence is the best way to go.
Yeah.
That's 100% effective method.
Have you ever thought about like having females getting prescribed for primobolan instead of TRT? I mentioned like
Yeah, yeah,
getting them prescribed 1 milligram or 2 milligram per week. So why don't pharmaceutical companies like develop a drug that contain 1 milligram or 2 milligram primobolan per week? Why don't do they?
yeah. I don't.
They
I think they're just too scared. Like it's too androgenic, I guess they would say. But I mean, something like Primo at such a low dosage definitely would have an effect, I would say. Like without, oh, not an androgenic effect though.
yeah, my when I was thinking about that, the first the idea came to my mind was the maintaining of muscle mass or in gym performance, which can
Yeah,
aid females drastically, considering that females have the testosterone concentration of 20 to 30 times less than an average male. On average, it's
yeah,
25.
yeah. Yeah, I mean, it's a great idea, but I'd see. I mean, I haven't actually looked online if there are studies where they've tested this, because I'm sure there are.
And
If
on
you
the
did,
other
if
hand,
you
it probably would have better like contraceptive efficacy too, because since
yeah,
it
exactly.
suppresses HPTA better than
Yeah,
the contraceptive pill alone.
yeah, yeah. I mean, you definitely. What's the word? I mean, there would probably be a few more fertility issues with the pill, which there are already that people don't speak about. But but I mean, it's definitely more effective.
Yeah, obviously we live in a double standard world that females get prescribed for nandrolone
Yeah.
derivatives and males get a middle finger for TRT when they have
Yeah, no,
5-year-old girl values.
it's just yeah, it's ridiculous. It's like as soon as you mention TRT, oh, but your fertility is you're not gonna be able to have kids. It's like, well, if you look at the studies, the chance of infertility is more or less the same for the pill. So why are we just
Exactly.
giving out the pill for people who just want better skin? They give you the pill. It's like, I just want to feel like a guy. Well,
That's
yeah.
what you mentioned is quite important because in like mostly in Nordic North European countries or in North American countries, we see that uh, we see females who can much easily uh, transition uh, compared to a man who seeks just his testosterone values to come back to baseline. They seem
Yeah,
to prescribe
it's
that
huge.
testosterone much easier than the
I think they're just scared that if they deny the person testosterone, they'll be looked down upon for not being progressive, and they're more scared about that than like if they deny someone who's looking to
transphobic.
transform. Yeah, they'll be transphobic. Whereas if they deny a guy TRT, well, they're doing the right thing because TRT is too dangerous.
Yeah, I'm obviously not a transphobic, but I cannot put my head around, or is it correct to say that? Put my head around the idea of prescribing testosterone or transitioning a 12-year-old female to male instead of delaying his or her puberty.
I mean, it's a difficult topic that
Yeah,
I'm definitely not qualified to answer, and would be better in the hands of someone with like, philosophy degree in bioethics. But I'd be interested what an expert in the field would say, and what the justification would be. But yeah, I'm all open to anything really. Yeah,
uh,
it's a interesting topic.
what's the average doctor's view on individuals who want to transition in South Africa? Just
I,
mostly, I mean, like female to male individuals. Obviously, we are talking about
oh yeah.
testosterone and androgens.
Oh, of course. Yeah, I actually don't know. I myself, I would be more than happy to help someone. I'm not sure. There are definitely um, a few individuals who are a bit more reserved that I went to medical school with, who I doubt would be a fan of it. But yeah, most doctors would do what they thought was right, I think. Or I'd like to believe they would, but obviously I can't speak for them.
So we mentioned TRT protocol would be just testosterone drugs or the drugs that makes your gonads to secrete testosterone. That will be
Yeah,
the typical TRT. But regarding the
exactly.
HRT, is does HRT have a place on folks who do not benefit from only using testosterone, aka adding tiny bit of maybe like nandrolone or maybe adding a bit of primabolone. By the definition of a bit, I mean less than 50 milligrams, not 200 milligrams a week. In addition,
Yeah. Yeah. I assume you'd have more info on this topic since it's like I know in as you mentioned in Turkey you can still get primo and stuff. So I assume it's a bit more open there. We do not have primobolan or nandrolone here in
I
our
guess
pharmacy.
Spain
So
is the another country that you can buy Primobolon legally.
and what are the thoughts in Turkey about it?
Uh,
Is it
is
used
Tur-
commonly?
No, it's a bit hard to find. There is sort of like economic crisis on the horizon in Turkey nowadays. It's a bit hard
Mm-hmm.
to find drugs. Obviously, there is like the SGK, obviously an equivalent of NHS in Turkey.
Okay.
NHS is in UK, so that's the
Yeah.
equivalent of NHS, and the SGK forces like I would say drug warehouse where they store drugs before like shipping to pharmacies. They
Yeah.
force them
Okay.
to sell drugs at an euro currency of €6, which but nowadays the euro currency is roughly 15 Turkish liras. So
Okay.
there are political problems too. They accuse them of
Oh, I see.
storing drugs and not selling it to publicly and making profit, but obviously that's not the case.
Yeah.
Uh,
Very interesting.
but you can find drugs or big going to bigger pharmacies. They can gain drugs much easier than the smaller ones. I couldn't
Okay.
find
Yeah.
Nebido. I visited almost like 5 to 6 pharmacies, and later on I went to a big pharmacy, and I found out that they had 3 Nebidos and about 2.
Okay. Well, yeah, do you need a script for those,
Uh,
like a prescription?
SGK doesn't cover Nebido. They just cover Sustanon. They don't cover testosterone gel too. They just cover Sustanon
That's interesting.
250.
So, okay. Yeah, no, here it's quite
My
tight
doctor
with it.
didn't write me a script either. Uh, he just wrote it on a piece of paper and told me to buy that. Since SGK doesn't cover that.
That's so interesting. I heard in Turkey you can also buy human growth hormone over the counter.
Prescription free. Yes, yes, you can.
That's interesting. Wow.
Yeah, British people can just come Turkey, go to overseas places, and can make a great vacation while they're on cycle of
Yeah.
hemoglobin and growth hormone, prescription
I
free.
know that when I go to Turkey, if I when I'm older and I'm losing my hair, I'm definitely getting a hair transplant in Turkey.
I gotta warn you that there are many clinics who do not take enough responsibility while treating the patients. But I mean that, like doctor uh, putting holes on your scalp and not doing
Yeah.
anything else, and letting the nurses do completely everything else. So
Oh,
in
I
my
see.
yeah in my literally in my vocabulary, that's the definition of irresponsibility.
Yeah, yeah.
Yeah.
Okay, well, I definitely would
So
need the
be
help of a
careful while
local such as
picking
your
the
help. So.
hair transplant clinic. That would be my advice.
Yeah, I probably need your help. Well, let's just hope I don't go bald.
You're probably not. I'm my hair length has been receding since I was 14. I guess I don't know why, but it's not genetic, I suppose, because my both of my uncles on my mother's side, on my father, or anything else in
Yeah.
family had a hair loss before they 40, but I started losing my hair at my 14 years old.
Would you attribute it more to like, are you like a a stressed individual? I don't know. Sometimes there are links to that.
Uh, I don't really know. Am I a stressed individual in general? Yeah, maybe I can be a bit more stressed than the average person. Uh, I I just I know a few guys who use 25 milligrams on top of their TRT in order to manage estrogen, because one, they whatever for whatever reason they aromatize uh, much more than you can imagine.
Yeah. Yeah.
And the second reason is their nipples are too sensitive, or they're just they get fluid retention. Uh,
Yeah.
in my uh, those guys benefit it seems like those guys benefit from using 25 milligrams of primobolan
Parmesan.
while
Primo.
while lowering their TRT. Let's say they are using 100 milligrams a week. Instead, they
Okay.
start using 75 milligrams and add 25 milligrams of primobolan.
Okay.
So,
Okay.
in a sense, they have less substrate for aromatase enzyme, and they have
Okay.
a bit of more androgen that cannot that is not a substrate for aromatase enzyme. So it helps them to manage their estrogen.
That's very interesting.
Yeah.
And it's like that more of like a, not bro science, but like more like gym talk slash forum talk. Like it's not a medical thing, or is it a
Exactly.
medical
It's
thing
not
that
it's not a medical thing. They just
but I mean it makes complete sense.
it's in a sense it's a DIY TRT.
I mean, it makes sense though, because you do get those guys who like you don't want to put them on an aromatase
Yeah,
inhibitor
I saw
because of
their
that.
lipid panels too. They were horrible when they were on
Yeah,
AIs, and while on
yeah, it's,
while on primobolan, their lipid values are much better.
yeah, it's like you really do not want to, unless you have to, you really do not want to use an AI on, lifelong treatment.
It should be a last resort, right?
Yes, I mean, they give AIs like candy when you're on TRT. Like they tell you to take 1 milligram of Arimidex a week, or well, we have just plain old anastrozole here. But it's just, is it really necessary? And like the long-term benefits or, risks of it are just not really worth it, in my opinion, because you can easily control estrogen via other routes, just as you've described.
Yeah. Do you think that the decadrabolin or nandrolone has a place in TRT? Obviously, uh, people who suffered from injuries in the past tend to use
Yeah,
the nandrolone in addition to TRT. Do you think that it
yeah.
has a place in TRT or HRT in
Um,
general? It's technically it's not a TRT
HRT in
anymore.
general. I think it should be treated similar to how Primo is, because it also doesn't really, it's not a substrate for aromatase, and it also seems to be um because it does convert is converted by 5 alpha reductase to, what is it, 5 alpha,
Dihydronandrolone, yeah.
yeah, dihydronandrolone, which I don't know if this is correct, but it's like half the potency of traditional, just DHT, which for someone who, has prostate issues, benign prostatic hypertrophy is not really going to put you at risk of cancer, but it is uncomfortable to live with. And so using, let's say, like 50 milligrams, if you are on 100 milligrams of testosterone, using 50 testosterone, 50 nandrolone could be a benefit, because nandrolone does tend to maintain sexual behavior, libido, mood, but I've never really seen it in practice.
Uh, Regarding the AIs, I found out that it was like 6 to 7 months ago. There was in some countries there were many compounding pharmacies that compounds testosterone with AI. So the patient
Oh,
did not have any choice of using testosterone alone. They were suspended in oil already, vial.
how did that get approval?
Is there
That's
any
yeah, that
compounding
is
pharmacy? Is that a thing in South Africa, like in US?
nope. I don't know about the US. I mean, in South Africa, definitely not.
Yeah, we don't have either.
Very interesting though. I've never heard of that. I wonder how like they got approval for it, if they've done like trials or anything.
So also regarding the aromatase inhibitors, uh, in my very limited experience regarding the AIs, I found out that the aromasin tends to cause a bit less HDL reduction compared to
Yes, I
arimidex.
think I've noticed that too.
It seems like
Aromas in yeah.
there are some things there are some other things that we just don't know yet other than estrogen.
Yes. Yes. Because yeah, I mean you target estrogen, but estrogen isn't just estrogen, I guess. There are so many different things that estrogen does.
So what should be the frequency of injections, of testosterone injections in general? What would be your advice?
Yeah, it kind of depends on which ester you're using, obviously. And then I enjoy saying something like do a more frequent as you can kind of dosage regimen, just in order not to get all those peaks, because then you have to run into the estrogen issues and you really don't want the person to be taking an AI, or they start getting, acne or something, or they get this like massive high. That's a common thing. You like they get a testosterone high and then drop the day afterwards, and then they want it already. And it's like, well, you've already taken what you have for the week. So as often as possible, so you kind of take the half life, and yeah, I would go with the terminal half-life of the drug and see how you feel on that. And if you are getting more side effects or you feel like you're getting this massive peak, then I would inject more frequently with a lower dose. I don't
Do
know.
you
What's your take
do
on
you
it?
see any value of daily microdosing with insulin syringes? I mean, for example, injecting
Yeah,
testosterone
like
anethate or cypionate daily, like 10 milligrams a day. Do you see
I'm
any value?
actually interested. I'm interested in it. Like, it's definitely interests me because you know how it would kind of stabilize your levels. But this is why I'm so interested in testosterone undecanoate, because with undecanoate you do get those stable levels, but with enanthate and cypionate there's always a peak, whereas you don't get that peak with undecanoate. So microdosing, if you don't have access to undecanoate, could actually provide a useful a therapeutic tool if you
I
don't want
agree.
those peaks all the time. But I think, in my opinion, undecanoate is the way we're kind of gonna go. It just, I mean, a lot of bodybuilders don't mind injecting themselves frequently, but the average male doesn't want to inject themselves all the
Well,
time.
I personally haven't felt a difference of technically I haven't, but I haven't met or seen anyone who benefited from injecting testosterone anethate or cypionate over 3 times a week for bodybuilding
Yeah,
purposes. Obviously, those guys were on super physiological levels, but I haven't seen or met anyone who benefited from you injecting frequent more than 3 times a week.
yeah. I mean, I once made an individual do it. He was still getting side effects, and this was on cycle, and we wanted to mitigate them and see. We were just playing around with dosing schedules, and as you said, the 3 times a week seemed to be most beneficial. If you went lower than that, you'd have the same. I mean, if you went higher, like he started doing every day injections for 6 weeks, made no difference. Than doing the every 3 days. And when we tested his testosterone levels, it was more or less the same. So it seemed, and estrogen seemed to be more or less the same. We thought maybe there would be, less activation of aromatase if the peaks weren't so high, but after 3 injections a week, it made no difference. But I don't have a study to prove that. That's just one case scenario.
Anecdotal.
Yeah, but I mean, it seems, I think 3 injections is like, with an anthocyanate, is kind of the cutoff.
Should HCG be a gold standard in TRT in males who
so.
just have, let's say, 200 to 300 nanograms per deciliter of testosterone endogenously produced? So they might maintain that and they might partially maintain their fertility. So they might also prevent scar. I know it sounds ridiculous, but there is a minuscule chance of getting permanent scar tissue in your gonads when you don't, when they don't work over like 2 decades or so. It's still a thing.
Yeah, they actually did a study, like they did a whole compilation of different postmortems of steroid users, and the incidence of testicular fibrosis was like 24 out of 26 of them had testicular fibrosis. I mean, I don't know if different compounds have different effects of this, but I'd assume 19 NORs might be a bit more of a culprit for testicular fibrosis.
I was going to mention 19 NORs. The guys I met or talked with, 9 out of 10 of them mentioned that their HCG was not working enough, working at all when they were on 19 NORs. They had to use more HCG. That's a completely anecdotal.
So
I have no data to support that anecdote, but it seems like it's a thing, considering that they are highly suppressive on HPTA.
Yeah, I mean, like, we know they are, but it's like, I don't know. Do you know like why they are so suppressive? Like, I'm sure there's some molecular biology behind it, but I don't know.
No, I don't know that. But I just want to tell one thing that, which is mostly talked in bodybuilding forums or steroid forums, that nandrolone or trenbolone is super suppressive. Yes, they are suppressive, but they mention that they talk like as if using trenbolone will suppress their HPTA much more than 100% suppression. It's not a thing. Technically, you can't close a factory that's already been closed, right? They are just more suppressive per milligram per milligram. Milligram per milligram. That's the thing. They think that it's gonna shut down them further when they are already shut down 100%.
Well, yeah, exactly. You can't shut yourself down more than most guys on TRT are shut down. Like, it's less than 0.1 FSH, less than 0.1 LH. So it's like, how can you shut yourself down further? Not that I'm saying you should add on a 19 NOR if you're already shut down, but I'm just saying it's like a funny concept.
Do you think, what do you think about the so-called testosterone deficiency epidemic among the males? Is there a thing? Is,
Oh
is
my,
it a
yeah,
thing?
all of these conspiracies. I don't know. I don't know. It does seem to be more. There does seem. I don't know if more people are aware of it, and that's why it's becoming like more popular. But I don't know. What are your thoughts? There are like all of these thoughts about the pesticides that they use nowadays, and BPA was used to be one of the bigger things.
Yeah. Uh,
What's your
in
thoughts?
my opinion, there are three major things that contributes the uh, earlier testosterone deficiency in life. I mean, by earlier definition, I mean earlier than 25, roughly. You might think that
Okay.
before 40 or 30. Uh, I'm taking the average, 35.
Yeah.
Before
Yeah.
35, it seems like more males have testosterone deficiency compared to what it was like 1960. The
Yes.
I would say that the obesity has the primary
Of
obesity is the
course.
primary factor. And the other two thing is, I would say, sun exposure and just a combination of BPA and maybe it sounds like a conspiracy theory, but the drug metabolites that accumulates in fish or other animals. Technically, the some
Yes.
drug metabolites that it cannot activate our receptors might activate the other receptors on other animals. That would be my take.
Definitely. I definitely. Yeah. Obesity is definitely.
Yeah.
That's for sure linked to low testosterone levels. Yeah. The vitamin D sun exposure is also a massive thing. But yeah,
Yeah,
it's
it's
interesting.
directly or indirect. There's indirect and indirect effects of vitamin D, and also like circadian rhythm, like the depression,
Yeah.
overall feeling of well-being.
Yeah. Exactly. I mean, I last blood test I did, I was vitamin D indeficient, so I'm supplementing now because I never go outside.
Yeah, I recently found out that I can get vitamin D like 30 times cheaper by buying 1 ml intramuscular vials with using
Really?
yeah, putting them in dropper and using just one drop every
Uh,
other day. It gets 30 times cheaper.
it's such a big market here for vitamins and stuff. Like it's so expensive. So I just like write myself a script for pharmaceutical grade vitamin D and then get it that way because it's so much cheaper.
Yeah, my take is always drugs over supplements. Most 9 of 10 times, you get what you pay for. 100%. You
Exactly.
can get faked. You can get underdosed, and actually sometimes you get overdosed, like in Bayer's Primobolan. Technically, they have over like 1 ml of
Yes.
oil, like 1.05 or 1.1 mil. Technically, you get more than you pay. You pay for.
Yeah, I
Like
also heard
comparing
about that in
berberine
the
to
paper.
like comparing berberine to metformin. You get what you pay
Yes,
for metformin, 100% all the time. You can
exactly.
not have anything else. But with berberine, you can get other like unknown drug interactions or underdose product or even like heavy metal contamination. They're not well.
Exactly. Exactly. And I mean, with metformin, it's actually cheaper than berberine.
Yeah,
Metformin costs
100%.
nothing.
It costs nothing. Exactly, I agree with you. So, regarding the thyroid health, also, could you explain the definition of hyper and hypothyroidism?
So for hyper and hypo, so hyper just means there's more, and you get primary and secondary with both. So if it's primary hyperthyroidism, it means you're secreting too much TSH from the pituitary to the thyroid in your neck.
Your
And
literally
then,
your thyroid is somewhat unresponsive.
this is in hyper, sorry. And then I'll
Yeah.
do hypo.
Okay.
So in hyper, you get if it's secondary, it's coming from the brain to the thyroid, and you
I
get
see.
more thyroid production. If it's primary, the thyroid itself is, sorry, my bird is going a bit crazy. If it's, can you hear him?
Yeah, it's
Okay.
not annoying. A bit.
Okay. So with primary, it just means the thyroid's doing it. Typically, we see primary hypothyroidism with in things like toxic multinodular uh, conditions. Then you get hypothyroidism, you get primary and secondary. Primary meaning the thyroid isn't producing enough, so you get so much TSH because it's so unresponsive. Then in secondary, your TSH isn't being secreted. That's as much as I know.
Yeah, in my family, like thyroid problems run in my family. My aunt actually she like every 3 years or so she shifts from hypo to hyperthyroidism.
Does she have Hashimoto's?
Yes, yes.
Okay, yeah. It's actually interesting if you know the my molecular biology behind it. It's because you become hypo because it's like initially you're hyper because your thyroid gland is being destroyed and releasing all the hormones. Then you become hypo eventually because your thyroid gland has become
Mm-hmm.
destroyed, and then as it becomes more destroyed, you go between these states. Yeah, the Hashimoto's runs in my family also.
Well, also I have an Hashimoto's. My endocrinologist also checked my thyroid gland under ultrasound, and the doctor who did the ultrasound said that yes, there was a thyroiditis. That's what she said, and it
Thyroiditis,
seems like
yes.
Hashimoto's, and it's not an acute thing. And she said it's been there at least for 4 years or so, more than 4 years. So it's not a new thing.
Interesting. Yeah,
So my
I also
fatigue,
have
my all of
Hashimoto's.
my physical symptoms was not because of the thyroid.
Okay. Yeah, I had a similar thing. I was used to be like normal weight slash a bit chubby. Then
Mhm.
suddenly I thought it was just anxiety, but I lost all this weight and things. And then I became I had hectic hypothyroidism. And yeah, since that they realized I had Hashimoto's and my thyroid gland had been uh,
How was your
overworked.
T3 and T4 levels?
So T3 was actually normal. T4 was subpar. So I assume I was making enough. I was overproducing on those deiodinase
Mhm.
enzymes or something. But TSH was about, we have different reference ranges, I think. It was 6.
Did
So
you have high thyroid antibodies like
they
anti-TPO?
surprisingly they couldn't find any, but on ultrasound they said it looked the ultrasonographer was this old radiologist who had seen a few cases. He said it looked like typical Hashimoto's, but I didn't have antibodies, which was the interesting part. So I don't know what it was. They just said Hashimoto's, and yeah. So I've been on L-troxin levothyroxine, 150 micrograms. I was on 125 not too long ago, and I've been bumped up to 150.
Have you seen any difference after bumping up to 150, like increased body temperature or increased heart rate?
Yes. Well, it's difficult to say because it's summer here now, but I am boiling, and I don't know. I actually think I look better. I'm like not storing fat as easily, especially around my truncal region.
Have your
I don't know. I
appetite have your
Yeah, my
appetite increased?
appetite is through the roof. As I was put on T3 with tertroxin, but I did not agree. Like it made me feel awful. So I'm just on T4 at the
So
moment. So
the T3 made you a bit jittery, like some people get that.
incredibly jittery, palpitations, couldn't sleep, and I was on 10 micrograms every other day. So it did not agree with me at all.
It could be almost counted as microdosing T3, like 10 micrograms every other day.
Because it was originally 10 micrograms every day, and I was dying out. I never felt worse in my life. It felt like I was, my heart was giving in. It was awful. And then she said, try every other day. Tried that. It didn't really improve.
What was your heart rate? Was it over like 120? Was it literally racing?
Well, I
Your
might have
resting heart
beat it
rate.
like my resting heart rate is usually 50, and it went up to 87 or so, which is like, for me, is a lot. And since I've upped my T4, heart rate hasn't changed, which is why I prefer T4.
Yeah, after getting infected of COVID-19, my aunt had a thyroiditis, and her heart rate was her resting heart rate was over 110, and they put her on propanolol, and with propanolol her resting heart rate was not less than 80, still, like it was like 90 or so, 85. And over
Really?
time it got resolved, like
Okay.
after 2 months or so.
Okay.
Have you
Thank
have you
goodness.
got infected of COVID-19?
Yes, I had it last year. Um, and possibly this year. I don't know. I didn't really test. But yeah, I had it last year, and I haven't had my smell and taste back. It's like back, but I'd say 60% back since last year, October. And then recently, well, as you know, South Africa discovered Omicron, and it's been going around. No, quite a bit. We actually tested. Now it says on your test if you have Omicron, and a few people close to us have tested
Do they
positive. And
test everyone with Omicron, or just
yeah,
the ones?
like now it's like your PCR positive, Omicron
Uh-huh.
detected, not detected, or something. So I'm quite sure I had it because it was worse than the first time. I had, typical, just like lost my smell completely again, but it's kind of gone back to that 60%, and I've been coughing like, and my sinuses are screwed. Like they're so sore if I do that. Yeah,
How
but
is it a common thing to have patients who are anti-vax among the anti-vax population in South Africa?
it's so big here. I don't know what it is. Everyone's anti-vax here. Um, so we're actually at the moment we're trying to distribute our vaccines to the rest of Africa because we manufacture them now, because no one seems to be using them, and a lot of them are going off.
Maybe you guys should stop searching for new variants so that they won't blame the South Africa.
That's probably going to happen because it damaged our economy because everyone had to cancel their holidays here. So, and corruption is massive here. So the government's going to get involved this time. And if they find a new variant, definitely going to tell them not to mention anything.
Do
Like
people wear masks in closed environments?
Yeah, that everyone wears masks everywhere here.
Thank
Yeah.
God. I went to Konya, like it's a 5-hour train line away from
Yes,
Istanbul,
I remember
which
you
is where
saying.
I live, to get treatment, PRP treatment. Also, I went with my mother, so she got treated. The doctor treated her ankle,
Oh,
knee, and
nice.
her hip, I guess.
Hmm.
Also, her heel. She has a heel spur.
Shame.
uh, in Konya, almost no one was wearing masks at all in closed places too. It was
Yeah,
almost like a disaster.
yeah. I mean, you get a lot of people who are against it, but it's just like, I don't want to get your illness, so please wear one.
Do you did they? Is your glass? Is it blue or the thing you drink
No,
is
it is
blue?
blue. No, it's just water, but it's blue.
Did they start the booster doses of COVID-19 vaccine in South Africa?
Yeah, I'm actually meant to get mine because for some reason the doctors here got Johnson and Johnson vaccines, and it was a one-dose thing, but now they're giving out boosters. I actually need to go get that soon. I
So
wasn't in the
how
mood
many
to
have
feel
you got
sick.
in total so far?
Only one, but I need another. My parents have had three. They had the Pfizer. Well, actually, my dad, who lives in Saudi, he had AstraZeneca, the first one in the booster, and then he just got Pfizer. So they're mixing it now.
Yeah, my cousin who lives in UK now he got two different vaccines. First was AstraZeneca and second was BioNTech, Pfizer BioNTech.
I mean, they're mixing and matching here, but as
Yeah,
long as
in
I'm not
Turkey
sick, I'm
it
in.
was a really like a the when the vaccinations started, it was pretty much like a circus in Turkey. They started using
Really?
like Chinese vaccine, and later than they introduced the Pfizer BioNTech vaccine, and it was ridiculous. Like they
Yeah.
it and the second dose was not enough protective, and they had to introduce a third dose, and it was not
Really?
still effective. It's and they when someone was talking about the third jab, they were mentioning the one who got the Chinese vaccine for two times, and later on getting the Pfizer for their third. So it was really complicated to understand.
No, we had we were trying to bring in the Russian one, or something. I forgot
Sputnik
the.
5.
Yeah, Sputnik. Yeah, Sputnik 5. Because we were at one stage we didn't have enough vaccines, and now we have way too many and no one's taking them.
Uh, so, is excess iodine intake uh, is unhealthy, or does it have a place in thyroid nodule growth or in thyroid cancer? It seems like in last
They,
2 decades or so, higher iodine intake seems to be responsible of higher thyroid cancer prevalence, I would say.
I'm not an expert on it, but
Yeah.
in terms of cancer risk, so we have done it before. Iodine isn't really included in that, but I mean, I'd be interested to see how. Well, I mean, we actually have problems with lack of iodine intake here, and they get the goiter, where their thyroid gets big. Seen that a few times because iodine intake is poor.
Isn't that a common thing to have iodized salts already? Like,
Yeah,
isn't that a common
we
thing?
do all, yeah, all salts are. Um, but yeah, I don't know. Still seen goiter a few times.
So,
But
yeah,
yeah,
please go ahead.
interesting. No, it's just I don't know. I've you're the first one who's actually mentioned it to me, and I'd be interested to see what you think about the
Uh,
relationship between.
well, in the home I grew up, my mother obviously had problems with her thyroid, so we were diluting the iodized salt with uniodized salt. So we were, and also we were using a low salt. Like most of the uh, food we cooked were like Mediterranean food mostly. Uh,
Oh yeah.
but I see the value of diluting the iodized salt, especially in athletes who has to or loves to consume higher sodium, because either they uh, lose a lot of electrolytes, also maybe That's how they love their food. My recommendation is if they consume very high doses of sodium, they probably need to dilute their iodized salt with uniodized salt. And also it would be probably a good thing, especially maybe like for females. It might be in theory, because especially females who have very high HCG values during pregnancy, they can get
Yes.
very low T4 levels, because HCG has thyrotropic effects, like
Yes.
T4 secretory effects on higher concentrations. So they might benefit from diluting their salts with like having one thyrotropic effect of iodine here, and on top of that you get the HCGs. And imagine a bodybuilder who already uses HCG for maintaining fertility. On top of that, he uses a high salt approach. He has a high salt approach, so has high iodine intake. And again, on top of that, he uses growth hormone. So there are many very thyrotropic stimulus. So it might be a good thing for them to dilute their salt. It's a quite simple thing, but it's quite effective. At least that's my opinion.
Yeah. Yeah, it's interesting because I've actually seen cases. It usually in women, it's called like a molar pregnancy, where they have extremely high levels of HCG secretion and they get this thyrotoxic picture. So like the typical, like, you know, weight loss, rapid heart rate. I've seen it before. It's interesting, but it does typically not with a normal pregnancy because their HCG levels aren't as high, but with a molar pregnancy, they tend to get these massive increases in HCG.
In some cases, can doctors prescribe females with exogenous T4 in order to reduce the thyrotropic effect of high HCG levels? Can they prescribe that in order to lower TSH and the overall lower the thyroid stimulatory input overall?
They don't. The gynecologists and obstetricians don't really enjoy playing around with the thyroid too much during pregnancy because it becomes a massive issue with things like miscarriages and stuff. So I don't think they've experimented with that, but it's an interesting hypothesis.
Do you think, is there a value of supplementing with exogenous T4 in especially professional? Can professional bodybuilders benefit from using exogenous, literally microdose T4 in order to reduce the thyroid, I would say thyroid burden? Maybe like in order they get big, and in order to maintain that thyroid serum concentration in blood, literally their thyroid gland has to produce more T4. Yeah. That's the thing.
Actually, the other day, the video I did on it was about like steroids and boosting the metabolism. It was found that a lot of steroid users in all of the studies actually had thyroid burnout. So like low T4 levels, their TSH levels varied. Some showed high TSH, some showed low. It wasn't constant, but was noted for sure was that T4 was lower than baseline. So perhaps there would be a benefit in supplementing with T4 to avoid that like burnout, as you say, from like all of the hormones and stuff, and especially from the strenuous workouts.
Yeah, the reason I asked is mainly because of thyroid health or avoiding the cancerous growths, because obviously they abuse insulin, growth hormone, high body weight. They have high body weight, high kilocalorie consumption, like all the anabolic environment, high protein intake, And if
Yeah.
they use on top of that, if they use HCG for some reason, like let's imagine they want to maintain testicular volume, and they use nandrolone and 19-node testosterone, literally 19-node testosterone itself. So anecdotally, they gotta use higher HCG. So it's even there is in total more thyrotropic effect or
Yeah.
growing stimulus. So those folks can, I think that those folks can benefit from using like 25 to 50 micrograms of T4 to lower their TSH, to lower their
So,
endogenous thyroid growing signaling.
okay. So would you say that you wouldn't be in favor of HCG for that thyrotropic stimulus because it does work like TSH, and if you
Yeah,
are
if they
supplementing
are using high dose and long term,
high
I would
dose, yeah.
say that it's a good thing to supplement it with low dose of T4 to lower the endogenous TSH and thyroid stimulating overall
So you'd
stimuluses.
essentially be replacing your TSH with the HCG and so lowering your TSH to a level of, let's say, like almost zero, and then replacing it with HCG, not on purpose, but like suppressing it
No,
with
no,
T.
that's not my point. Just to uh, have the same T4 and T3 levels while lowering your TSH by, let's say, 25%.
Okay. Oh, okay. I do
Yeah,
get what you're saying.
because people won't realize, but in a decade or so, we will see much more thyroid cancerous or thyroid nodule growth among the bodybuilders who abuse
Yeah.
those things.
Yeah. Well, definitely, if you put yourself in this anabolic environment with like your diet, growth hormone, yeah, I've never really thought about the risk in um, steroid users, but I suppose there is one, especially if their TSH is chronically elevated.
So the last thing, do you have enough time? So when will
Yeah,
when
I just have, so it's 2 o'clock here. I'm assuming 3 p.m. by you. So
yeah,
at 2:30, I just need to get ready because I have to go out.
okay. So
So I have like
the
25 minutes.
obviously the last thing
Yeah.
I want to talk about is injuries. They suck obviously, but we need to
Yeah.
avoid it, and people we need to tell people how to avoid it. So uh, the primary reason for injury is most of the time is obviously poor programming. There is nothing you can do to cover the poor programming. Uh, how even
I'm a
even
victim
if
of
you
poor
use
programming.
over 10 years of 10 IUs of growth hormone, you cannot uh, negate the negative
Yeah.
effects of poor programming.
Yeah, I mean, I myself suffered from poor programming. I've got a long-headed bicep tendinopathy because I was told to bench at like the typical way to bench is like pinching
Wide
your
grip and
shoulders
not
back.
retracted shoulders. Is that
Yes.
how you got?
Yeah. Actually, with retracted shoulders, and I think that put too much the retraction. I was going too crazy with the retraction, and like therefore
Well,
I was putting way too
it's
much stress on
multifactorial.
my bicep.
Maybe your ulna and radius, your elbow to wrist is maybe proportionally longer than the average person. So
Much
you might
longer,
benefit
much.
from
I have short
widening.
arms. I have
Do you have
short
shorter arms?
upper arms, short upper arms, very long lower, well, forearms.
Very long forearms. Is it
Yeah,
correct?
very
Yeah.
long.
So
Yeah.
maybe you can benefit from widening your grip a bit, so you will get less shoulder extension, or you might bench in a squat rack, so you might You might start from a dead stop.
Of course, of course.
That
Well,
that
I
might
mean,
be
you're
quite beneficial for your shoulders, especially considering that how long forearm you
yes.
have.
Well, I mean, I would definitely take any advice to help this go away, and you are the expert on injuries.
You why start by widening your grip like one figure every week. So uh, assess assess how you feel overall and stick with that. I know it sucks to change your grip, but it takes like 3 to 4 weeks to
Well, I mean, I
adjust.
can't even, at this point, I don't bench anymore because it is just too uncomfortable. So I go with like the machines.
No, do you feel okay with dumbbells? How do they feel?
And dumbbells, yeah. I go with dumbbells and machines because, dumbbells you can easily adjust during the movement. So I've kind of just, I mean, I've stopped ego lifting.
Also, my advice would be just not to avoid push-ups. Most people or most power lifter just
Yes,
use
agree.
their retraction movement of their scapula for injury prevention, but they don't realize that your scapula has upward rotation movement, and serratus anterior does that. How do you train that? It's mostly by overhead pressing and push-ups. Literally, those are probably the best two exercises you can do for your serratus anterior. And don't forget your properly executed push-ups. And I didn't realize how important those were till like 4 years ago. Also,
Okay.
push-ups are
Yeah, you're
cool.
teaching me a lot here about exercise
Yeah.
execution.
Yeah, you.
And
So thank you for your compliments, but obviously, according to most of the, I would say, fitness enthusiasts, since you are the biggest guy in the room, so you must have the best knowledge.
it's like the worst thing. It was like, yeah, people on the internet trusting guys just because they're big, even though like they're on stuff. So it's like, yeah,
So if I were bigger, would it make me more knowledgeable? Yes, but it doesn't necessarily mean that a bigger person would have all of my knowledge or better knowledge than me. It doesn't necessarily mean that. Correlation is not
yeah,
causation, right?
exactly. I know.
So
But I mean, yeah, I'm very interested to hear you. Pretty much, you have to lecture me on this stuff because it's very interesting.
do you uh, obviously there are some so-called form Nazis, especially on Instagram, who just accuse of them not properly doing like squat or not being so-called pussy because they are not high bar squatting, but they don't realize that that person has very short torso and has very long femurs. So in order to have
That's
balanced,
me.
uh,
It's that's because I have the short torso, the longest femurs. My knees are so the most of my height, so I'm 6'4". Most of it comes from my femurs, and like I cannot squat past parallel. If I try, I cannot squat. I just become too unstable and I
yeah,
fall
because
over. So everyone,
you completely flex your hips. You cannot go below that point without like bending your lumbar. You're
exactly,
uh,
exactly. And
having
so
your hunchback.
I used to do it. Yes, I used to do it just because the old guy at the gym, his name was like Yanis, I think. He told me, no, you can't, you need to squat ass to grass. And I did it for a while. I got strong that way. But then I got back pain, lower back pain, and crazy neck pain because I had to do that in order
Do
to
you
reach.
squat? Do you high bar squat or low bar squat?
I did do I do low bar most of the time now. I think. Yeah, I mean, I don't squat that much anymore. I kind of moved over to the leg press because I found
Yeah. Do you
it was a
use heel
lot
heel
less.
lifts in your shoes or like weightlifting shoes to get
I
much better range of motion?
I haven't actually. No, I just I'm I do very basic stuff when it comes to lifting. Just yeah.
Yeah, I hate like spending $100 for a weightlifting shoe or $200, but
Yeah.
in my experience, the best thing, or also it is probably the one of the most affordable way is like having shoe lifts like specifically designed to heel lifts specifically designed to put your uh, foot under your foot soles. Is it called
Yeah.
foot soles under in your shoes?
Yeah. Yeah.
Yeah, put under
Yeah.
those things, and they are really rock hard, designed for like CrossFitters to get more forward knee travel, essentially making you to easier to make squat lower or as to grass. They are
Yeah. Yeah.
quite
Well, I mean,
effective in my opinion, and they are not putting you off balance like some weightlifting shoes, almost like putting you off balance. It sort of feels like uh, walking in high heels.
no, I mean, I was set up for failure as soon as I went into the gym because there are so many old guys in these gyms in South Africa and they're big guys. So like they'll tell you what to do and no, your knees can't go over your toe. And I was just struggling to get my squat form right. And it's the same with deadlifts. Like with deadlifts, I can't like my deadlift looks more similar to like a straight leg deadlift, but that's just more comfortable for me. But in the beginning, I tried to force it, and it just caused more problems.
Well, if you're not interested in powerlifting, like maybe you can benefit from just sticking with RDLs or stuff like that, deadlifts.
Yeah, I've swapped over to RDLs. Those like I've never felt pain when doing RDLs.
Also, most people can don't realize, but when they are the concentric phase of RDLs, the movement mostly must come from your glutes. Most people just try to use the erectors to get hip extension. It literally it sounds ridiculous, I know, but they gotta use their glutes and use your glutes not to get injured. That would be my advice for novice lifters.
Yeah, that's one thing I do because now I have after I started doing RDLs, I've got stretch marks on my glutes.
They're
Not
quite
very
effective,
appealing.
especially like glute ham tie-in when they where they meet. They are that's where RDL shines, especially.
Yeah, no,
So
I definitely like.
I gotta admit that the I'm not a fan of buying so-called research chemicals from unknown sites. But
Yeah,
the best looking site I've so far seen was actually a South African site.
was it researchpeptides.com? Dot
Maybe
coza.
it can. I guess yes.
Yeah, okay. I do know the guy.
Do you know the
Yeah.
owner or the guy who
Yeah,
you use?
the owner of it is also one of the like leading guys who does he specializes in like the orals. Um like he in making orals he doesn't make injectables, but he like all of his orals are like the company's called Liquid Pharma, and they're like the gold standard here. All of them, it's more expensive, but it's all legit stuff.
So there are obviously some drugs or PEDs can enhance the soft tissue recovery. So could you shed a light on this topic too? So anything from like
I
GH,
mean,
growth hormone, to DECA.
Yeah, well, in terms of DECA, it's quite interesting. DECA has like, I didn't realize it, but it has like local IGF-1 factor production, um, which might be it's especially localized to the joints, which might be the reason it improves joint pain. But um, yeah, GH and DECA, I would say, are one of the researched ways of dealing with joint issues. Ones with good research. There are many peptides, but I personally haven't experimented with them, nor do I know anyone who's really used them. I don't know if you know people who have used like the BPCs and the TB500, or, you know.
Well, there are some concerns with obviously with BPs and TB500 since they both increase the like creating of new
Yeah,
vessels, blood vessels,
angiogenesis.
so angiogenesis.
Yeah.
So if you have a cancer, that's probably the last thing you want to have.
No, that's was my concern, but there's not enough research, and if I bring it up, I just get shut down. It concerns me that it causes angiogenesis. Everyone says that's the positive,
What do you
but
mean
for
by
me,
shutdown?
but like, if I were to mention it on Reddit or something, everyone would, get upset, because for some reason people get upset when they're told that, maybe you shouldn't use experimental compounds. But yeah, that's the major concern, because for us, or for oncologists especially, when they hear angiogenesis, they're they're looking for ways to prevent angiogenesis, especially around the tumor.
Yeah, on
That's how,
Reddit
like, in the
there are
past,
tons of people who tell you to shut the FU and take the 500 milligrams. Don't be a pussy.
well, no, or they'll tell me that, no, I've used it with great results. Okay, that's cool. It's
Yeah,
like,
maybe you are the lucky one. Maybe you want
okay.
you want to. There is no guarantee that you won't get maybe like cancerous growth much easier or much
It's just like,
on a
yeah,
much faster rate 10 years or 20 years down the line.
yeah, I like it's concerning, and like there isn't enough research to say yes or no, and it's like I can't prove, but it's like, just don't use it unless like there's enough research for it. That's as simple as that, I think.
I found out that actually like uh, EPO has a quite anabolic effects. It doesn't seem to
Really?
increased mTOR PI3K in animals but it seems like in vitro studies it has that capability, and for like uh, tendon to ligament to cartilage healing, uh, EPO has quite beneficial effects, especially on local stem cells. A minuscule amount of EPO seems to increase the cell viability of bone marrow derived stem cells drastically.
Really?
Yeah, and I
I
found out
I
that
never thought of that.
injecting there was it wasn't a high quality study, but there was a study comparing to dextrose prolotherapy, literally like 15 to 25% of dextrose injected intrathecally compared to
Mhm.
erythropoietin, and erythropoietin had much better results. And there was also animal studies that showed that erythropoietin actually activated the local stem cells in the injured cartilage area, and they had better growth, better also meniscus growth. And also, I
Really?
found out that there are histological studies that showed that local EPO and administration uh, improved the histological. There was a uh, interesting like there are pointing systems like a grade of 1 to 4 generally of tendon histological health, and they
Yes.
quickly improved their tendon histological like histologically their
Yeah.
tendons were
Yeah.
improved. The animal tendons were improved less than 3 weeks.
That's so interesting.
And also,
I mean, I know where you can get EPO, so I'm gonna.
I can get EPO prescription free.
Oh,
Erythropoietin
nice.
alpha. Yeah, and also I'll probably ask my doctor since I got his number, the doctor who did PRP on my shoulders
Yes,
and
yes.
elbows. I'll ask him to mix EPO with my whole blood before making the PRP, and after getting the PRP, adding more in that already 100% ready PRP to before injecting my shoulders essentially. But I'll offer him to do uh,
A case report.
a case study of me literally.
Yeah,
I would
that would be.
offer.
Yeah, we always
He
look
has
for patients like you.
he's a great guy. He is probably uh, one of the best 10 guys out there in Turkey who can use ultrasound and combine
Really?
the regenerative injection therapies. Like he has the capability of thinking outside of the box. It's
Yeah, it's
almost
always nice to meet people like.
by the there are also like other regenerative injections like PRP,
Yes.
prolotherapy, uh, anything from stem cells or so-called stromal vascular fraction, which is literally like uh, fat source cells that are digested by collagenase. That can you can easily get rid of the fats and you have the like only like stem cells fraction. That's the reason why they add
What?
collagenase.
Okay.
Also, there are like micronized fat injections. Like till a couple of years ago, we
Have
didn't know
yeah.
that, but we now know that mechanically activating the cells have some. They changed how cells respond. They like uh, getting in an alarming state that they have to be alive and they are stressed, so they kind of become sorta more anabolic.
That's very interesting. Sure.
So, but people forget that there are uh, a common thing between those three, like between PRP stem cells and prolotherapy. They are both introduced with a needle. There is always a mechanical and a volumization thing going on, and
Yes.
the same thing for goes for dry needling too for tennis elbow. It seems like
Yes.
it does
Yeah.
work for some
Okay.
individuals.
So there's a combination of different ways in which it could work.
Also, my advice for the guys or gals who will get or got PRP treatment is just using don't forgetting to take over a gram of vitamin C. Just the
Okay.
cofactor of collagen synthesis.
That yeah. Vitamin C is quite a good one to add. Especially
Quite
yeah, a
cheap, quite
gram.
cheap, right? You can get a kilo for I don't know less than 10 US dollars. Can you
Yeah,
get
I take a gram
those
with
that cheap?
breakfast and a gram with dinner.
Yeah, I got a like powder vitamin C in 200 in cups that are weighted 250 grams for a cup, and I weight them in a very sensitive scale with the back of the smallest spoon I have in and but I found out that you can it it's almost like tastes like tangerine or lemony in a concentration of 500 milligrams per 500 mLs. So literally 1 milligram per 1
Ah,
ml. It's quite drinkable in water.
Thanks for that. I'll give it a try next time.
Yeah, if you like, some guys like, some people like sprinkling
Lemon water.
lemon in their water.
Yeah, I
So
like it.
so you might
I'm
like it.
definitely gonna give that a try. Yeah, I usually just take it. Yeah, but that'll be cool.
So my advice, for my last advice for like BBC, PPC 157 and TB 500 is, yes, they work, but you gotta have the right environment for healing. You cannot, you don't expect getting healed when you are benching like, classical guillotine, using guillotine pressing while
Yeah.
trying to injure your irritated long biceps, the long head, the tendon of your long biceps long head.